how do you decide when you're going to fix this? Is it skin wrinkle test? Is it blisters? Is it always wait 10 days? Is it always do it right away? Obviously, always and never are pretty uncommon words, but how do you think about the acuity when you fix these?
I think another interesting point, I'll definitely get to that, is I was wondering because the patient got an X fix. It is often quite helpful. Depends on what's happening at the time and what your setup is. But if you say, you know what, this is going to get an X fix right off, then just hold off on getting the CAT scan first, and then put get them distracted, and that can sometimes help kind of sort things out and make it look the CAT scan look a lot bit better, and help you kind of figure out what it really looks like once it gets in traction. Because I think this is obviously out of the CAT scan,
Yes,
out of the this was before the X fix. So with that said, this is kind of Still's fracture. It may look better right now, once he's in the X fix with the distraction, if you got another CAT scan, and I think it does. So as far as timing, I'm kind of my setup over the years has been just wait, and just wait 10 to 14 days, and then pick a day, and then come back and do it. With the exception of somebody who's maybe sitting in-house because of some other reason, if they can't leave the hospital, then I'm a little more kind of liberal about getting them to the OR earlier and checking on them every few days. And if they're just waiting in the hospital to get the tibia taken care of, then I'll sometimes go earlier. So yeah, but it's most of the time I'm going to say I'm waiting 1 to 2 weeks.